Hi, Casey.
Hey,
Hector.
hello.
So, the subject of today's topic is New Year's resolution for patients that I think would be a good thing to think about coming into the new year. So, these are things that I observe on a regular basis, habits and things that people are doing or should not be doing or should be doing more of that directly can affect your quality of life, and they're related to your teeth and dentistry in some way. All right, some of them may be a little bit abstract, but they ultimately are things I observe, and that I think would be good to focus on coming into the new year. So I will tell you, the first thing I can think about is smile more. And the reason I say this, I think we all know, it's understood that if you smile more, your response from people is going to be considerably better. So if you just try the experiment one time, go into your local coffee shop, and instead of thinking about your day and going through the motions, you actually look at the person you're working with and you smile, it's a totally different chemistry, right? And I will tell you that patients of mine who have had their smile done, when I see them on a routine basis, they'll remind me, they go, you know what change it's made since you fixed my smile. People think I'm nice, people talk to me, people ask me questions, people give me compliments, people all of a sudden involve me in conversations. And I remember there was a time when I didn't like my smile, and I went to my local orthodontist and I needed to show more teeth when I smiled because I was having a hard time showing teeth. And when I did fix it, it was like a new tool. It was like a new weapon. And this is a very important thing to consider if you want to improve your interaction with other people in a very positive way. So if there's something holding you back from smiling, and I've found that there's lots of people who just don't smile because they're very ashamed of their smile, or there's something, I was just buying a car the other day, and the lady who was working with me, very attractive, very well put together, and she smiled, and her front two teeth had a stain between them. And I'm like, oh my God, I want to fix this so bad. If she only knew how much that is holding her back and how easy it is to fix, especially with today's technology, such as the BioClear and whatnot, or Invisalign. It's just amazing because, unfortunately, people make judgments, on that. And to fix that is something that's a game changer. So smile more is the first one. Exercise more. So what does this have to do with your teeth, right? We all know exercise is something we want to be doing more of, and we're all planning on doing it. What I've found with this as it relates to my interactions with patients on a daily basis is I always think and talk to my staff about the 10% rule. At any time, there's 10% of my patient population, or the population in general, that's ready for change. A lot of times that starts with their teeth, because you get the momentum going in the right direction. So if you're sitting around, you're like, gee, I really feel like I'm kind of going downhill. If your body's going downhill, I can guarantee your teeth are going downhill too. I help a lot of people with getting a plan to fix that entropy, get their teeth going in the right direction one step at a time. And the funny thing is, the next time I see them, they've lost a little bit of weight. They fixed their hair. Their skin looks better. They're exercising more. And it all started with going in the right direction of that energy gradient, that if you do nothing is going this way, but if you put energy into something, and if you feel like you have the resources and the help to get there, then they start to exercise more and get their body back in shape, and they start heading in the right direction. So exercise more would be key. Another simple one is stop using your teeth to bite things, or using your teeth for things that you should not be doing with your teeth. A lot of people don't even realize they're doing this, or don't know that this is affecting their teeth. But I'm very tuned into this. I will see people starting to lose their edge, pun intended, right? Where the edges, the incisal silhouettes that frame your smile, the edges of your teeth, as that silhouette starts to get disturbed or flattened or chipped up, it is something that ages you and that gives you that lack of being put together. And typically it starts with your bottom teeth. Your bottom teeth start to move, and what happens on the bottom affects the top, because that's the front line of the functional edge of your teeth, to where when you're chewing or you're talking, if you have a bottom tooth that's sticking out and it's hitting one of the top teeth, after a while the top starts to mirror what's happening on the bottom. Or if you're keeping a pin between your teeth, I had a friend in college, he always kept a pencil between his teeth, and every pencil you saw that he had was chewed up. Or tearing tags through their teeth, or people whose nails are really, really short and they have like bleeding cuticles. It's because they're going like this all the time, which is a nervous habit. That really starts to chip your teeth up and starts to look a little not so sophisticated, and it's not a healthy, hygienic habit anyway to chew your fingernails and to chew your cuticles, or chewing ice. These things are costing people lots of money, and so stop biting things with your teeth that you should not. Tobacco, right? Quitting tobacco. Obviously, a lot of times patients do not understand the effect. I always say smoking and teeth do not go together. And I tell patients, I'm not going to make any judgment about you smoking cigarettes, but I'm going to tell you, if your goal is to get to 100 with all your teeth, it's not going to go together with the smoking. And it's a very hard habit to quit. And even what's more difficult and just as damaging is snuff or chewing tobacco. Keeping this in your mouth, it's a frustrating thing to see. I see young people doing it, and it's destroying their gum tissue and directly affects the longevity of your teeth. Not only that, is a strong indicator for oral cancer. And I will see patients, smart people, where I see changes happening in their mouth that are the precursors for cancer, and they just tell me, it's not cancer yet, is it? I'm like, because I have a simple test that I can see that's 99% effective, that's non-invasive. I go, it's not cancer yet, but are you going to wait until it becomes cancer? And they look at me like, I can't stop. So as long as it's not cancer, I'm going to keep going. And it's a strange behavior, and I can't quite figure it out, but it's something to consider into the new year. Maybe stopping that tobacco habit. Drink more water. All right, I'm guilty of this. Go through the day like a camel, and it's like, gee, I start to talk and I start to get choked up because my throat's stuck together because I haven't had any water. In fact, can I have some water right now? Haven't had any water the whole day, and it's something that, yes, it can affect your teeth quite a bit, because if you're in a dehydrated state for the majority of the time, it changes the consistency of your saliva. And the saliva, believe me, if you start to lose saliva, and if your mouth is dry and you're waking up in the middle of the night with your tongue stuck to the roof of your mouth, you're going to get a lot more cavities. You're going to have a lot more problems with your teeth. So drinking water, what do they say, 8 glasses a day? Yes, minimum. I'm not one of these people to walk around with a gallon jug, but it's not a bad idea. Think about upgrading your toothbrush. It's funny. Talk to the layperson, they're like, I don't know, I'd like one of those Sonicare toothbrushes, but I don't know, it's kind of expensive. And I look at it and they're driving a BMW 7 Series. I'm like, listen, upgrade your toothbrush. It's a no-brainer. And I've talked about this many times. If you're using something, and I'm biased, I like a Sonicare. I've tried them all. We did a blog on the different toothbrushes out there. You have the Oral-B, which is, a lot of people like Oral-B. Sonicare is fantastic because you're basically letting the technology that they put into the head of this toothbrush do all the work for you. All you have to do is get it near your teeth, and it's going to clean your teeth 50 times better than a regular toothbrush. So upgrading your toothbrush and taking advantage of some of the features that are built into these toothbrushes, for instance, the pressure indicator, on the toothbrush. Even myself was brushing too hard. So, now they have the toothbrush has a rim around the actual head of the toothbrush that is illuminated. And if you're brushing too hard, it's going to show up as green if you're brushing right, orange if it's a little too hard, and red, flashing red if it's too hard. And believe me, it's easy to get to that red zone. So, if you're doing this, in my case, I brush my teeth a lot because I'm with this close to people all day long. If you're using that wrong technique all day long, it's going to wear away your enamel and wear away your gum tissue. So using that technology and utilizing that the proper way, it's a simple good habit. Consistent dental hygiene. I can't tell you the amount of people that have missed appointments, rightfully so, during COVID, right? But gee, has it cost them? I mean, just a lady yesterday, I'm like, what has happened? I say that all day long, and they're like, well, I missed the last 2 dental appointments. I'm like, oh, I forgot. Yes, they haven't been here for a year, right? Or a year and a half. And, they're scared to come in. But at this point, guys, it's safe to go to the dentist, right? Don't miss those appointments, because unfortunately, sometimes when I catch it after a couple of missed appointments, it's too far gone. Like in this lady's case yesterday, now she had perfect dentition. She is going to have a tooth removed just because she's missed a couple appointments. I mean, that's not the norm, but it certainly happens. So being consistent, as we've talked about, it's not just about coming in and getting your teeth clean. It's about the close observation of the trends that are occurring in your mouth to try to stop them early. There are 2 types. There are people that come in, they go, it's probably nothing, but I wanted you to check it out, and most of the time it is nothing. And I have others that have said, that come in and I see something bombed out. I'm like, when did this start to bother you? And they go, well, it's been about 3 years. I'm like, well, why haven't you done anything about it? I didn't think it was anything. I didn't really think it was worth coming into, and I don't have dental insurance, and, I just kind of ignore it. I'm thinking, what else are you ignoring in your body? I've learned through my patients that are smart, that listen to their body. If I have a little ache or pain, it's not like I'm running to the doctor that day, but I'm certainly going to research it and pay attention to it and see if it's a trend. So, if you have like a little ache going on and it's been happening 3 days in a row, yes, go in to see your dentist. Get that checked out. Same thing with your health, It's a smart thing, especially as you get older, to listen to your body and make sure that, because by now, if you're the age of 40, 50, you should be in tune with your body. You should know your body pretty well. I know if I am going to eat a pizza and I'm not used to eating that, or French fries, I know the next day my stomach's going to be really upset and I'm going to feel kind of sluggish. It's like, okay, am I going to ignore that and just take antacids, or I'm going to try to, cut down on that activity and listen to my body? I was just at the gym this morning. I was increasing the amount of weight on the bench press, which normally is something that's very easy for me to do. I was way below the weight that I typically use. I go to take it down. It felt tight in my left pec. I didn't let my ego take over because my little nephew was there. I wanted to show off to him. I'm like, I'm not going to go to 185 today. I'm going to stay on 135, stay in my game. If I would have kept going, probably would have torn a pec. So listen to your body, right? Prime example of how much time and energy and money can that save you. If you're listening to your body and I can find a problem and fix it at the point of a filling versus the tooth cracking and you needing a implant, that's a $6,000 problem that could have been fixed with $250. So another prime example. And I would say the last thing that I would put on a New Year resolution is check in with your doctor and see, hey doc, where am I on my master plan, right? You're now at the state where things are feeling good. You took care of the chips. You took care of the crowding. You took care of the gum grafting. You have all your A's and your B's. You may be getting to your C's now. Things further down the list that now you can take advantage of that momentum and get ahead so you can get predictability. So check in with the plan and see, because I can guarantee you, if you're with somebody who's into comprehensive planning, even with your medical health, there's a big picture, there's a plan that they've built specifically for your situation. And if you check in and have that kind of communication with your hygienist and dentist and say, where am I with my plan? And they say, well, let's look. Well, actually, this is what we want to work on into 2022. And now you feel like you have your hands on the wheel. You feel like you're not playing catch up anymore. You're not being reactive, you're being proactive. And you could get to that goal of getting to 100 with all your teeth, of not only having teeth, but having them and having that smile and having that edge and having that contribute to your overall health versus letting that part of your body, again, fall to entropy and have it detract from everything else and hold you back from so many things. So I think those are things to chew on, some things that maybe can contribute to a better 2022.